Hello.
My God, it's just a disaster. I was so upset. And that guy from
Don't
India,
be.
he is in India. He also cannot manage it. He is also
No,
struggling.
nobody can because my daughter just checked it.
Ah,
Insta Live collaborations are not allowed in UAE.
is it? Because I have seen so many of them doing it. I think they're using that software, maybe.
They must be doing it through something else. So no worries,
Oh,
we'll do it through Zoom. So
okay.
right
You
now
what
you
I
can
what I can
see,
do is I can send this guy to send this link across the contacts and in my Insta so
हाँ
that people
हाँ
can
you can
join.
do that.
You know?
YouTube live भी चल रहा है इस समय पे. Okay.
Okay.
It is gone on YouTube live, so it is public.
So whatever we are talking is live already.
It is already live. Yeah.
Okay. Okay, fine.
but
So
like I don't have too many followers or anything on YouTube, so you will have to what we can do is, so couple of things we can do right now. We You can go live on Insta, okay, and you can maybe turn the camera towards the screen,
yeah,
okay, and that can go live.
yeah,
Or later on, what we can do is we can clip this YouTube video, okay, and we can post these as reels.
yeah, we can do that. We can do that
What do
later
you say?
because with Instagram, what is happening, even with the live and I'm talking alone, it is getting paused on itself.
Yes, it is getting paused. Probably it is
And it
not allowed.
disconnects. It says it's
Yeah,
ending. It's ended.
yes, that's what is happening, because we tried attempting 5 6 people, different places, different networks. So I thought if it is my net, but my network has 200 ka speed.
Yeah,
So
even mine. Even mine.
exactly. So network is not an issue. It is probably the regulation. So
Probably
no
I'll
worries.
have to again check it. Okay, no worries. Let's then wait for a couple of minutes till he floats all this messages on the link and then we can
Okay.
start. Yeah.
Do you want
You can
me
take,
to get people on Zoom?
yeah, it's better.
Yeah.
Get at least a little bit of crowd. So then
Okay.
by the time we are through the thing,
Hmm.
then we can
Hmm.
get more
All
audience.
right. All right. All right. We can do that. I have. Suno, suno, suno. Which app they go through live from?
It's called, I think, StreamYard. StreamYard.
Mm, yes. Earlier, we used to do Facebook Live also through StreamYard.
Yeah, because I read all the whole tutorial, but
Okay.
then this fellow of mine, he said, no, you don't need that. You can directly go. So probably he also doesn't know.
Yeah, probably. Because I have done only 5 6 Insta lives. Okay, that too
Yeah.
in 2020, when I was too passionate about teaching homeopathic students. So that's the time I've done it.
Mm.
But
Yeah.
that homeopath, like there was a college student, she would join from her end, and we
Okay.
would join from phone only.
I see. Okay. Let me see if he has posted anything. You told your team anything
Um,
to publish this link?
should we?
Yes.
Okay, okay, chalo. Angel,
Okay, so he's put it on my stories. I'll tell him to put it on my post as well. I'm trying to join the link from my phone also.
Okay.
Okay. I sent you the Zoom link on Insta story as well.
Difficult, immediately for people to come on. So one of my patient has joined. I'm going to wait.
So many of my patients had joined, but
Yeah,
because of
I could
this,
see that.
they just.
Yeah, I could see that.
So even if we are at least 5 people join, we can still begin, and then we can post it on the stories or wherever it is relevant.
Mm. So far, only my that patient has also gone. My daughter has joined, but I don't
Okay.
want to put them in the. Should I just?
She's joined?
Yeah, but then should I accept them in the meeting right away?
How old is she?
She's 22.
It's okay.
No, no, I'm
It's okay.
saying whoever comes as and when they come, should
Yeah,
I
yeah,
just
just keep
let them
joining.
enter?
Let them join in. Yeah, yeah.
What we'll do is we'll disable the waiting room. Okay,
Yeah.
whoever wants can straight away join.
Dr. Vishali, we can start now. You need
Yes,
unmute.
let's
Yeah.
start. Let's start.
Okay. Perfect. So, a very warm good evening to all of you who have joined. And we were supposed to have this session on Insta Live, but somehow we have drifted and we are now getting it done on Zoom. So, thank you all for joining in today for this session. And this particular session is mainly dealing with the aspects of depression. And it is not as a label, diagnostic label, but it is a conversation that truly matters for every one of us. So it is a conversation that goes beyond our past struggles that we have in life or uh, or whatever stresses we come across. But today is the time that we need to pause, we need to feel, and then begin on the journey of healing. So whether you have walked this path all by yourself, or you have supported your loved one, or you're just joined here for a deeper understanding as to what this means, then this is the right space for you. So let me introduce myself to you. And my name is Dr. Devinder Kapoor, and I'm a specialist in homeopathic medicine, practicing currently in Dubai, UAE. And with my years of expertise or experience, whatever you say, of over 23 years, I have come to realize that there is something more beyond just symptoms. We need to understand the whole individual as a person, so that comes to understanding and recognizing the holistic approach towards the mind and body. So it's not just getting better at the level of physical signs and symptoms at body, but it is also going deeper into the energetic layers of the body. We need to get healing from the root cause. So I have devoted my clinical expertise of 23 years holistically in this profession. And today, joining us live is also someone whose voice brings both wisdom and compassion to this topic of depression. She's like a guide, guiding through the shadows, a believer in the light that still exists beyond with all of us. So I'd like to welcome also Dr. Vishali to share the platform with me. So to give a short brief about her, she's a consulting homeopath practicing in India, and she likes to call herself as a happiness strategist, a happiness health coach, and she believes a holistic approach in treating and healing. So that's how we connected. With over 24 years of her clinical experience and transformational experience, she has worked with students, professionals, leaders, and recently she has been an author and published her own book called Uplift. So, without further ado, I would like to deep dive into the session. So, Dr. Vishali, can you please tell me how do you define depression, both from a conventional and a homeopathic perspective?
First and foremost, thank you, Dr. Devinder, to initiate this most needed discussion for our society. So, depression as a clinical entity comes after a diagnosis of over 6 months. Okay, somebody has felt sadness, feeling lost, feeling unheard of, feeling uh, unworthy, and these kind of feelings remaining consistently for 6 months. And there are any five of the major criteria which DSM 5 talks about, which is the diagnostic manual. However, in everyday practice, what we see is depression does not necessarily look like only sadness. A lot of times it comes out in irritation, it comes out as a disconnect, inability to concentrate. It also comes out as, something which you loved, now you are not enjoying it anymore, and you feel um, sort of disconnected from your reality. And because it takes 6 months for us, minimum 6 months for us to diagnose it, the symptom become a part of your life, and therefore depression goes unnoticed. So major depressive disorder, which is the clinical diagnosis for depression, that goes unnoticed in most of the individuals, and you are only identifying it when the person is not able to keep up with his job, when the person is not able to keep up with relationships, and when there are major big failures, or a substance abuse, dependence on alcohol too much, or dependence on certain relationship too much, when such kind of morbid symptoms come up, then only we are able to identify depression. So today's talk, I feel, is most important, that we should be able to give a clear perspective as to how clinically depression will look like. So Dr. Devinder, I want to ask you that in your practice, how do you decipher, or how do you differentiate between a regular burnout or a sadness? How do you differentiate that?
Yeah, that's a good question. So there can be different, feelings or emotions. So, for example, sadness. Sadness is just like a natural emotional response, and it is often seen as a consequence of a loss or a disappointment or a change. So, this feeling is usually very transient, and people can still find moments of joy, connection, and motivation within it. Burnout is another, on the other hand, a state of emotional, physical, and mental exhaustion. So, this occurs because of prolonged stress, especially it is seen when people are in work stress, or caregiving roles. And this is marked by fatigue and a sense of reduced accomplishment. But depression is deeper. It's not just about feeling sad or tired. It is a pervasive sense of or a feeling of emptiness inside, hopelessness inside, and total disconnection from the outside world. It can affect your sleep, appetite, concentration, and even the will to live. Unlike sadness, it often persists without a clear external cause. In homeopathy, we don't just treat the label, but we explore the unique emotional terrain or the soil of each person. Whether it is grief that was never healed, whether it was suppressed anger, or it's just a constitutional vulnerability. From you, Dr. Vrishali, what I would like to further ask you is, how do you think that depression is seen in today's society?
You know, I have treated as young as 8 year old having depression, from 8 year till 80-year old. So depression is quite rampant. And even today, after road accidents, second number is for suicide, for the cause of death. So that itself speaks for it, that depression is such a disease which has gripped our society. Okay, so right from young age till older age, we are seeing these symptoms, and it is presented in a very different format. So as a homeopath, and going beyond that, now as a happiness coach, what I see in my uplift program as well is, a lot of times people are unaware of what triggered depression. So it can be different for different age group. So in a younger age group, typically children, so I have presented a paper wherein, I have discussed about my line of treatment for children having depression. And I had done a survey also in a very elite school, wherein children come from very good families, settled families, not disturbed one, no financial burdens, and even then,
I would just request all participants to mute themselves. Yes. Sorry, doctor.
no problem, no problem. So, even after having very good families and good setup, still children feel depressed, because nowadays there is an impact of social media. It is something like, you can't live without it, and with it you have difficulties, right? So children are suffering, the young adults are suffering, because there is a constant, like, if I have to speak in their language, they are in a delulu, that children are showing something, portraying something different, and in reality there is a different life. So there is a huge disconnect from people. Okay, we should ask everybody to mute themselves. All right. Yeah. So
So it can occur all the age groups, in all the
all
age groups it
all
can be.
across, yes, absolutely, absolutely. And with children, I must caution that it is a very, very short span. So depression can be diagnosed in just 15 days. Scientifically, we can diagnose depression in just 15 days. And there are neurochemical changes which are happening with depression. Therefore, we must be extremely cautious with it. It is not just a feeling of sadness, as you mentioned. It is much,
Right.
much deeper. And there can, as a homeopath, if we identify the root cause or the trigger of depression, we can solve it very, very easily. It is, even our case taking is designed in such a way that we are able to identify. In so many cases, I have seen that, um, when people come with major depressive disorder, they themselves are not aware that they are having this diagnosis, that
Yeah,
they
true.
have been suffering with it, and they come for maybe hypertension, or maybe the hypothyroid or something like that, and we end up telling them that this is your diagnosis and we must treat it. So
Yeah,
that is the beauty of being a homeopath, that we are able to pick up and identify symptoms very well and treat it effectively.
correct.
Yeah. Now I want to ask you, now that we are talking about homeopathy, and how, homeopathic person understanding takes the lead role in our line of treatment. Have you noticed any constitutional patterns wherein, have you seen it, that there are underlying depressive states available already, that, there is sometimes it's just the soil which is ready and the trigger comes and then depression starts. Have you noticed that?
Yes, yes. So when we speak of here, I would like to highlight that there can be two different types. There can be constitutional or neurobiological patterns, as you mentioned, which can be already there can be some disruptions in our brain. For example, hypothalamic pituitary axis, which please mute yourself. I would request everyone to mute. Thank you. So it can be disruptions at the level of hypothalamus and the frontal cortex of the brain, which can impair the emotional regulation and the motivation. So this in turn can disturb our body's rhythms with sleep, appetite, and so on, because the autonomic nervous system also starts to get involved. So with that, what happens is we have low energy, fatigue, cognitive symptoms can be seen. There can be negative thoughts or negativity about oneself, like negative views of self and the world and the future. There can be emotional patterns also. So, emotional patterns which are frequently seen in depression is a persistent or a consistent sense of unhappiness or emptiness. It is not just limited to feeling down, but it is a continuous sense of emotionally being numb or just being flat. There is loss of interest or in play or any pleasure. There is a fading feeling of joy in things that once that person loved. For example, if a person loved music before or art before or anything which he or she was passionate about, but there is no more that sense of joy in it. There are feelings of worthlessness, guilt, and it is not proportion to what the situation may be. And this in turn leads to self blame, shame. There can be a lot of irritability, frustration, especially in children or men who show it up as agitation rather than they go into a shell or a withdrawal. Hopelessness can also be seen with a sense of as if there's a fixed thoughts in their brain that nothing will change and all the efforts that are taken are just futile. So this is like they have their own shell, they go into their own thoughts, own fixed ideas. So these are all pointing towards some sort of a depression. Depression has its own stages.
True, true. Also,
Uh,
I think it is more evident in women. They are more disposed to having depression because they go through so many different cycles of hormones, and that also adds to them.
yeah.
Also, there is a natural, like, evolution wise, women are always struggling to find their identity. So they are more vulnerable and more susceptible to depression because their identity is never found. Even in
Yeah.
workplace, you see that there is a disparity as to how men would be treated and how women would be treated. Therefore, their sense of or their self-worth never gets to that level wherein they are able to form their own identity, and therefore they suffer with depression more.
Yeah.
Even if they suffer more, still the incidence you cannot find it because they are not the one who will seek help. There is a kind of martyr syndrome which women are gripped with, that they will be the ones who will sacrifice everything and who will work more. So therefore, I feel as a homeopath, it becomes our responsibility that whenever a lady mentions some, a subtle sense of being lost or not feeling the same joy, we must take it up on ourselves and explore it and give them that opportunity of finding joy.
Yeah, that's so true. That's so true. We often tend to even miss these kinds of symptoms, you know. We feel that it is common. The members of
No,
the
it,
house may feel it is common. Okay, Dr. Rishali, what treatment approaches you think that can be more effective from somebody suffering with depression? What is most effective? Do you think lifestyle changes are important, or any medication is important, or any alternative therapies or alternative treatment will help?
So, in my 25 years of experience and handling more than 28,000 people, what I've realized is not one single approach is ever going to be useful. It has to be a holistic, multi-directional, multifaceted approach to one case that can bring back to, because depression is such an entity that it is not just a disease which we need to revert, but we have to bring the person back to vitality. That means even before the person got depression, he has to go back to being himself. So therefore, meditation will play a big role. Alternative treatment. So I do not call homeopathy as an alternative treatment. I think that is the main line of treatment. Okay. So absolutely, homeopathic medicines will work. And as you all know that homeopathic medicines are proved on humans, therefore we have the mental symptoms available already. So to a large extent, our medicines will take care of the uh, disease itself. Okay. So first and foremost, medication. Lifestyle changes will have to be taken care by the entire family. It is not a standalone thing. So the whole family, there has to be something wherein the person has felt missing in relationships. So the entire family has to adjust and make room for a different kind of a lifestyle. So definitely lifestyle of not only the patient, but the entire family has to change. And then there are allied sciences, so many therapies which can be useful. EFT is one of them, emotion freeing technique, wherein different tapping, very simple tappings can be taught to the patient. And meditation definitely, but in initial parts, when the patient is too much preoccupied with his own thoughts, meditation can be difficult. So you can give them something physical to do. So basically, all these biochemical changes which are happening, for that, movement is something which will release, happy hormones as well, plus it will flush out toxins. So initially a walking meditation is something which can be given. Walking meditation meaning you just play the meditation music and go for a walk. That's it. Or if somebody is not interested in meditation music, I'm okay with it. I can always say that play a Bollywood song and walk, go for a walk. Even that can disconnect you from your reality. So that's the whole point. Then movement is definitely will play a big role. I would also urge people to engage into some sport activity, because that will also release happy hormones naturally. Then life psychotherapy can be applied. Like, there are so many different methods, techniques. Robert Karkoff model of counseling is there. REBT is there, rational emotive behavior therapy, wherein we go on questioning the whole foundation of the thought process of the person. And then I have a beautiful model which I use in Uplift, which is called as TFCAR, wherein we engage into thoughts, feelings, actions, and results of every every aspect of the personality. That gives excellent results. So for me, these are various methods, and it is never one thing. It will always be an amalgamation of various paths which we'll have to engage into. Okay. And
Yes,
gaining trust of the patient will definitely be one of the most important things,
it's
right?
true. Yeah, because one therapy would complement the other, right?
Yes, absolutely, absolutely.
True.
So I have realized that the trigger or the patient, whatever is the causative factor which brings the patient down to depression, can be very very small. But there are some stories, some narratives which the patient is carrying with himself um, throughout his life, and that is what brings him to depression. Have you noticed anything like that? Like, there are different narratives or emotional expressions which are playing a major role in getting the patient to depression, and also from homeopathic perspective in remedy selection that helps.
Yeah, yeah, totally. Because the emotional symptoms may sound common from a depression perspective or a depression point of view, but the patient's emotional expressions, when we talk about a homeopathic perspective, they are like the central pillars, and it directly leads to a remedy selection. So, unlike any other conventional approach that often will categorize the symptoms into diagnostic labels, homeopathy, it seeks to understand these individuals' unique expressions of suffering, their inner turmoil, what emotional tone they are talking about, what is the symbolic language of their own distress. Homeopathic case taking is very deeply narrative, and homeopathic practitioners often they listen for the origin of the story. Where did it come from? How did the depression begin? Was it triggered by anything like grief, betrayal, or isolation, or any loss? The emotional aspect, it directly tells us about a remedy selection. For example, if the patient is having a sadness or a yearning or a mild yielding disposition, it points out to a remedy like Pulsatilla. Or if the person is silent and withdrawn and gone into their own shelf, it may point out to Ignatia or Natramure. Or the person becomes self critical and there is so much of despair and guilt, it goes into Orometallicum. So these symbolic expressions also, when the patient is describing like a heavy stone in my chest with all these kinds of mood disorders, I feel brain fog. This also can guide the remedy selection by because it just depicting a remedy language,
Yeah.
the modalities, what is worsening their symptoms, what is relieving their symptoms, what time of the day they feel better, they feel bad. whether company is ameliorating or not ameliorating, all that adds further specificity to the remedy match. So for a homeopath, emotions are not just symptoms. They are pointing towards the remedy that is resonating with that patient's inner state. So that becomes very unique. And homeopathy is one of those sciences which empowers the patient to see their symptoms more meaningful rather than pathological. And
Dr. Devinder, if you allow
yeah,
me, I'll share a case which
sure,
I treated
sure.
many, many years ago. 80-year-old man, he was shifted from Delhi to Mumbai because his son and daughter, both of them were living in Mumbai. And they said that you are 80 now, you can't be living in Delhi alone. So he and his wife were shifted. And their cook was a Marathi lady. Okay. So for a Punjabi to eat Marathi food, it is little difficult, right?
Yeah.
So this guy already he was uprooted from there. He always had a very volatile temper. So he had that Punjabi abusive kind of a language, and he was little hot headed. Always like that was there. But when he came here and he was like disconnected from his land, from his food, from his friends, everyone, he became extremely depressed. But his expressions were he used to have a fight with his cook every single day. And it would go to that extent that she would say, I am not going to come to your house. And he would also barge into the kitchen. And, it used to be like the whole ruckus. That's how his depression was seen. I treated him with mercury, okay, which is like corrosiveness, because what he was doing, he was corroding every relation which he had. And very beautifully, within 4 months, he came out of depression. And he said, पहले मैं पूछता था कि why me. Now I am asking, why not me? I will accept this. I will try Marathi cuisine. And he said, I will teach her to make chole. I will learn how she's making techa. So that was the kind of transformation homeopathic medicines can bring about. And that is also one case wherein depression is not seen as sadness. He never expressed sadness. So even then he had depression.
Yeah, exactly. It is not known to oneself, and homeopathy just does this magic.
Yes,
It can go to
absolutely
that level and actually, reverse the state.
true.
So
True.
even I remember just as you were explaining your case, I have several patients of mood upset, but a strong one that clicks me is a young lady, not married, and she lives by herself. She's a very wonderful architect and an interior designer, but she lives all by herself. She has a cat with her, and she had these episode of foggy brain and a lot of depressed mood coming from nowhere. But definitely there were a lot of inner traumas which were not resolved. When we go into that deeper case taking, we understand that this is the block coming from there. So, in order for her to let go of that, of course, she needed some therapy sessions, which was already in my mind that this would be my holistic approach. I need to first detox her and then give her some remedy. And then she needs to see some alternative medicine or therapist, not medicine, therapist, who could guide her through and let her go off the trauma and all the other things. But you would not believe, I just administered her Aurum Metallicum 2 doses, and she beautifully came out of it. I mean, she herself was amazed that, how I have, literally turned her other way around. So when you see these transformations for yourself, and the patient comes and he becomes the voice of homeopathy, it becomes really very pleasurable to see such patients that we can help them to that level.
Absolutely.
Yeah.
Absolutely.
So for all those who are attending this session, homeopathy, you should try it because it has been backed up with all the scientific evidences, and it is not that it's a placebo. It is much beyond that.
Yes, true.
Okay. So we have a lot of stories like that. So maybe we will continue our sessions and pick up few topics as what you like or on demand. The last question that I would like to ask you, Doctor, how would you track a progress in homeopathic treatment for depression? How will you track whether this person is getting better, and what would be the signs of healing that you would look for?
So there are a lot of scales. Okay, in we whenever we do a psychiatric diagnosis, we use multiple scales. Okay, so for major depressive disorder also there is a scale, and Connor scale is very commonly used to diagnose depression and also for follow up. So we definitely have a set follow up criteria for our every patient. In like beyond that particular set criteria, every 3 months I would do a Connors test, Connor scale for every patient of depression. So they themselves will fill it up. They themselves will rate themselves as to how they are progressing, and that would be quite self-explanatory.
So
So
it's like
patients have
a lot of self journaling they need to write.
no, not journaling. No, these are scientific scales which are
Okay.
designed by the American Psychiatry Association, or even WHO has some, and there are world over. Like even in India nowadays, we are using the ICD-11. That also has a lot of scales. Scientific questionnaire it is. So right at the start of the treatment, we will fill it up for them. So the patient will fill it up, not us. Okay. So all these scales are are to be answered by the patient. First, they will answer it. Then, in the middle of the treatment, end of the treatment, we will again get it filled from them. So the scores will be assessed. I also have something of my own, which is a happiness index. So which I ask people to fill up, and they receive an automated response to how their happiness index is going on. So we score it. Okay.
Okay.
So
Great. Okay. They also need to
also,
have a lot of practice in like self-healing techniques, like grounding, or practicing the art of gratitude, being thankful for what they have in their life, and not to get into that pressure of fixing themselves. They
yeah,
need to let go of the pressure of fixing themselves, because some days will be like, oh, I'm doomed, and some days they'll feel like a retreat, but both are expressions.
both
So
are
we just
okay.
need to practice it on a regular basis, some breath work, some kind of guided meditation also. Nowadays it's like whenever we talk to people that you need to meditate, they feel like, oh my god, I have to. It's like something like very difficult and impossible task. It's not like
It
that.
becomes as
Yeah.
one more thing to do.
Yeah.
That's why I said that first I don't never put them on meditation,
Yeah.
because meditation has to come from within. It doesn't come, and that's why they're into depression. So first you set them in movement,
Yeah.
some body movements. Ask them to go for a dance, ask them to go for badminton match or a pickleball, or just for a jog, run, something. Physical movement is something which is a must.
Yes.
Second thing, you can ask them to play board games. For me, that works, because the more human connection, oxytocin will be released and they will be naturally happy. So it is dose of happiness, DOSE, dopamine, oxytocin, serotonin, and endorphins. These four hormones are to be released, and you need to have activities set in that manner. So journaling will definitely come, but it will come towards the end of the treatment, wherein we will set them for life so that they do not relapse into depression. Because a person once is gripped by sadness, he can go back anytime. It is something like, the soil is always rich for that. So if we want to give them treatment for this particular episode and do not want the depression to relapse, then we have to set them for life. For that, I would give journaling. But somebody who is already in a state of overwhelm may or may not do journaling in the beginning. I have noticed that when you ask them to start journaling, start seeing gratitude, it becomes extremely difficult. So currently I have somebody in uplift program who is not able to write. So in uplift I make them write a lot about gratitude. Okay. So a big part of journaling is gratitude. Uplift is my 12-week program of happiness. So there is this guy who is not able to write gratitude at all, and I'm okay with it. Even though it
Yeah.
is compulsory, it is a mandatory thing. But I understand that right now the things are so dark that he's not able to see it. It will start once we identify the root cause,
Unfold.
remove it, and
Mm.
rewire and set him for future journey. Then it will
Yeah,
start.
yeah, it's like just like
Yeah.
peeling off the layers of the onion, you know. You have to peel the layer one
Absolutely,
by one. Yeah.
absolutely, absolutely.
Agreed.
And
Agreed.
Dr. Devinder, there is something which is, caught my attention nowadays, is there is this gut brain connection that offers a hope, and you talk a lot about it. So can you
Yes.
talk a little more and tell me what it is?
Yes, absolutely. So, with all these years of my experience, clinical experience, I truly believe and operate on this line that whether I'm treating any kind of clinical diagnosis, whether it is like mental health or skin health or hormonal balance or digestive chronic issues or bone problems, the majority part of the treatment lies in the gut. So when your gut is healthy, you can get free from so many issues. So we are all hearing about this gut brain axis so much now, and research and scientists are also endorsing it, that yes, there is something called as a gut brain axis. Gut is like our second brain, because also there is 80% or 70% of immunity, it lies in our gut. So we need to focus on our gut health primarily, whatever the expressions of your illness may be. Because it's just like a bidirectional communication, linking your gut with directly at the cognitive centers or the higher centers of your brain. So there is something called as gut microbiome. So gut microbiome always needs to be at a balance. So when there is a disbalance or dysbiosis, this sets to a chronic episodes of inflammation, so your gut health becomes poor. So in such cases, depending on the levels of toxicity that one has in their gut, if I try to make a correlation between a person suffering from depression and looking at the gut health, imperatively, there is a lot of inflammation which we need to settle it down. So it can be through detoxification. I practice a lot of detoxification, which is again through natural means and all homely made measures. It gives wonderful results. So when our system is full of toxins, if you take supplements, if you take medications, it's not going to work because your soil is not clean. When your soil becomes clean and you're detoxified, detoxification has become like a very buzzing word again nowadays. Everybody and anybody seems to be talking about this detoxification. So, to make it more simple and clear, detoxification is when you're cleaning your whole system. Imagine a home full of garbage and full of
I think we lost uh, Dr. Devinder's connection. Are you guys able to hear me?
then you treat it with gentle homeopathic remedies or any gentle herbs or plants, it will really work. So that's the way I approach for it, because all the neurotransmitters are sitting in our gut. So you can name it like serotonin or dopamine or GABA. Everything is there in our gut. If gut is not healthy, you will bound to have an emotional dysregulation. And if there
Okay.
is all our, I would say, sleep hormones also are sitting in our gut. So a person who's struggling from sleep and insomnia, look at your gut. So if your gut is not healthy, you're bound not to sleep. If you have sleep apnea, again, look at your gut. So there is a major concern in this hypothalamic pituitary adrenal axis in scientific terms, if I put it that way. It
Mhm.
governs our stress responses. It governs our balance of stress hormones, cortisol levels. So if you do a blood test and your cortisol is very high, you have to fix your gut because it is coming from there. And also this gut microbiome, it communicates with our brain via the vagus nerve. So vagus nerve is such an important nerve because it shapes up our emotions, the tone, the resilience, everything comes from there. So if your gut microbiome is not good, it's going to suffer. So gut microbiome can be not only good with probiotics. Probiotics will help only if you help yourself. So it can be from
True.
food, it can be from other gentle mechanisms. Just loading the body with probiotics is not going to work. So I have several patients who say that, doctor, I'm taking probiotics, I'm taking this, but it's not working. So we need to go down to basics and go layer by layer. That's what my experience is. What have you got to say, Dr. Rushali? Do you agree on this?
Yes, yes, absolutely. I agree with it because, no matter what you put in your body, whether you receive it, whether you are ready to receive it or not, that will decide, whatever is going to get absorbed or not. It is
Yes.
effectively going to be how ready, how receptive you are to receive external help.
Yes. Yeah, because body is energy, nothing else. Body is energy,
Nothing.
and our body is communicating through energy channels. So all our internal organs are also energy channels. So if your internal organ energy channels are not, you're not feeding it the right way, you would not get the right response.
True, 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 true.
Yes.
Absolutely. And the point
Great.
which you mentioned about vagus nerve, that is so important because the moment you feel a little bit of anxiety, you are kind of stimulating your stomach. And right from
Yeah.
there, only the whole gastrointestinal system gets irritated.
Yeah.
And, as you increase a little bit of anxiety, little bit of anger, again your gut is going to get troubled, and
Yeah. It,
it is just a vicious cycle that
yes.
one thing leads to the other, and again you, because your gut is upset, you will have anxiety, and again the vagal nerve will be stimulated, and this cycle will just go on. So the
Yeah.
easiest way would be, like, if somebody is suffering from depression, what I would ask them to do is definitely breath work, breathing
Yeah.
techniques, because that is what
Yeah.
will control the vagus nerve,
Yeah.
and contact a homeopath first,
Yes.
right?
True. True, true.
And the
Yeah,
third one
because
would be look at it from a holistic perspective. It is not just the mind or the body. Mind and body will always go hand in hand, and it will work in tandem. So you will have to look at everything at one go and not as a single entity.
true, true. Awesome. Thank you, Dr. Vishali, for this wonderful insights that you have provided. And I'm so grateful for the stories that you have shared. Your energy was simply radiating all through. And thank you for our beautiful community for showing up at a very short notice and listening with open hearts and holding such a beautiful space with so much of grace in today's live session. Thankful
You
for your
know,
presence and your comments. We are open to any question answers if you would like to ask us anything.
I'm grateful to you, Dr. Devinder, that you are opening up this space wherein we can talk so openly about simple things of life, and
Yeah,
where
it's no more a
it
taboo.
is so
Yes.
meaningful. So thank you
Yes.
so much.
Most welcome. If there are any questions, please unmute and you can ask. Yes, please, Mr. Gaurav.
Hello, Dr. Devinder. This is Gaurav here. I want
Yes.
to know, I'm 57 years old and I have issues with my weight, as in I'm just over 100. I've been trying yoga and fasting, and it's like a yo-yo, goes up and down.
Yeah.
So,
Yeah.
any suggestions that you have for me?
Yeah, so as I was talking a bit earlier, we need to look at several aspects of your gut health because you mentioned weight. So weight issues can have multidimensional causes. So we need to see how your stomach is working, how your small intestine is working. Even though you're fasting and doing all those measures, it's not working for you. So it's just like a yo-yo, as you said. So we need to look at your liver, we need to look at your hormones. How are they? Because if you're doing everything and you're eating clean and you're going for your walks and you're doing yoga, body should show some response because body is intelligent. But if it is facing a block from within, for example, your liver is weakened, your liver energy channel is weak, and it's not able to release out the toxins because it's a detoxifying organ. Liver is supposed to clean up all the toxins from our body, but when it is not able to do it, that means the liver energy channel is somewhere being compromised. So we need to look at that from a different perspective and need to fix that so that it starts functioning normally. So probably a detailed case taking also would be required in your case, because what homeopaths do is we sit with our patients for 45 minutes or 1 hour to understand all the aspects, and then we can advise you for a certain way forward.
Right. So where are you
Also,
based,
you need to
Dr.
look.
Devinder? Yeah.
I am based in Dubai, and my clinical practice is in Dubai Healthcare City. Are you from Dubai?
Okay. I am.
Okay, so I'm practicing in Femi Clinic Medical Center. I can send you the my contact number in the chat right away, so you
Very
can
well.
reach out to me. Yeah.
Very well.
Also, Gaurav, you need to look
Thank
at
you.
your sleep
Okay.
patterns,
Right.
because sleep plays major role in managing weight. Okay.
Thank you so much. Yeah, I need to look at my sleep patterns as in I think I'm overdoing my social media and I need more sleep.
Yes, definitely, because these are all vital parameters. Your sleep, because if you're not sleeping, again, you're not allowing your liver to work properly. The liver only
Right.
works at night.
Correct. Great.
Okay, perfect. I
I'll
have
be in
shared my
touch.
number in the
Thank you so much.
chat. Yeah. You can note down my number and be in touch.
Yeah.
Thank you. If anyone else would like to ask some questions. Okay, so I think no more questions. And okay, thank you once again, all you lovely people and Dr. Vrishali. And I'm thankful and grateful to you. So hope to see you soon with another amazing session.
Yes,
Till then,
definitely. I'm looking forward to it.
take care. Bye.
Yes. Bye-bye.